Hi, my name is Kaylin Vigil. I'm a student at the College of Nursing here at South Alabama, and I'm going to be performing the medication administration checkoff. Here's my nursing badge, and now I'm going to go ahead and scan my room. Okay, I would make sure that when I go to drop my medication and verify everything, that my door would be closed and I'll be free from any interruptions and distractions. So I'm gonna check my patient's order form and the medication administration record, or the MAR, and I'm going to verify the 5 rights. So I'm going to start off with the right patient, Jaguar Jones, the right medication, morphine sulfate, the right dose, 5 milligrams, the right route, intermuscular, and the right time, every 4 hours as needed for pain, Now I'm going to check and see if Mr. Jones has any allergies. His order form says he has an allergy to penicillin, and the MAR also says that he has an allergy to penicillin. Now I'm going to go ahead and perform hand hygiene and grab my medication. I'm going to grab morphine sulfate. Okay, now I'm going to check the order form and MAR again for the rights. So I'm administering morphine sulfate, and this is morphine sulfate. I'm going to check the expiration. It is not expired. The right dose, 5 milligrams. I will be doing this as intermuscular injection, and the right time, every 4 hours as needed for pain, and it has been 4 hours, so this is okay to administer. Now I'm going to go ahead and calculate my dose. So this has 10 milligrams per milliliter, and I only need to administer 5 milligrams, so I'm going to go ahead and administer half a milliliter of morphine. I'm going to go and clean the top of this. Okay, now that that's been cleaned, I'm going to grab the correct syringe. So I'm going to use my 3 milliliter syringe, open it using sterile technique. I'm going to uncap and draw out half a milliliter of air. There's my half a milliliter of air that I've just drawn out. And I'm going to insert that in here. And now I'm going to draw my half a milliliter of morphine. Okay, now I'm going to get out any air bubbles. Okay, I have no air bubbles. Here's my half a milliliter of morphine. And I'm going to recap using the scoop method and make sure that I do not touch the outside of the cap when doing so. Okay, now that that's recapped, at this point I would verify with another nurse if it was indicated, and make sure, and the other nurse would also verify that this is the correct dose. And now I'm going to go ahead and verify my 5 rights again. I'm doing morphine sulfate. I just drew up morphine sulfate. 5 milligrams. I calculated my 5 milligrams. This will be intermuscular injection, and given every 4 hours as needed for pain, So everything checks out on my order form and my MAR, and I have created a label with the drug name, the dosage, and the patient's name. So my label says morphine sulfate, 5 milligrams, and Jaguar Jones, and I'm going to go ahead and place that on my syringe and take my syringe and my MAR to the patient's room. I'm going to go ahead and set that down and perform hand hygiene again. And then I'm going to look at my patient's wristband and use two different forms of identification to verify that this is my correct patient. So Jaguar Jones, date of birth 8/25/1963. Jaguar Jones, date of birth 8/25/1963. And his medical record number is 4176352. And medical record number 4176352. Now I'm going to check and see if Mr. Jones has any allergies. His wristband says that he has an allergy to penicillin, and his MAR also says that he has an allergy to penicillin. So now I would go ahead and I'm going to explain the procedure to Mr. Jones, and I'm going to perform any pre-administration assessments, whether I need to check vitals or anything like that. I've explained the procedure to him, so now I'm going to perform the 5 rites again. The correct medication, morphine sulfate, his name, Jaguar Jones, the dosage, 5 milligrams. I'll be doing this as an intramuscular injection, and every 4 hours as needed for pain, and it has been 4 hours, so this is okay to administer. So now I'm going to go ahead and raise the bed to a normal, comfortable working height and lower the side rail. And I'm going to put on my clean gloves and goggles. I would go ahead and locate my injection site. This is an intramuscular injection, so I could do it as a ventrogluteal one, for example, and I would locate the greater trochanter and place my fingers accordingly. So now that I have located my site, I'm going to go ahead and clean the injection site. Okay. Now that my injection site is clean, I'm going to go ahead and uncap and administer. I'm going to administer this at 90 degrees because it is an intramuscular injection. I'm going to aspirate for blood return. There is no blood return, so I'm going to go ahead and administer the medication. Apply slight pressure as needed and dispose of my syringe into the sharps container. And I'm going to go ahead and remove my gloves towards the trash can using glove-to-glove, skin-to-skin technique. Remove my goggles, and I would dispose of all of my other items. And then I'm going to go ahead and raise the side rail and position the patient back comfortably. I would check Mr. Jones to see if he was having any allergic reactions. And then I would go back to the nurse's station and document my findings. So since I administered morphine, for example, I would note whether his pain had subsided or not after administration of the medication. So now I'm going to go ahead and identify the injection sites. So the first one that I'm going to show is the deltoid injection site. So I would locate the acromion process, which is right here, and I would have the patient put their arm down by their side and use 3 finger breaths from the acromion process, and I would not go any lower than about halfway down the arm, which is where the deltoid inserts. And so from here to here, I would form like a little triangle and insert it right about there. And then the dorsolateral injection site would be down here. So I would not go any higher than halfway right where that deltoid there inserts, and then no lower than 3 fingers breadths from the elbow. So my injection site would be here, and then since it's lateral, here on the side, so about this little rectangle there. And then for the abdomen, I'm going to go ahead and have her lay down. I would not go any higher than the intercostals or any lower than the pubis. And my ranges here would also be the superior anterior iliac crest, so I would not go any wider than there. And around the umbilicus, I would not go any closer than about 2 inches. So my window would be about right here for the abdomen. For the vastus lateralis injection site, I would locate the trochanter, the greater trochanter, and use a full hand's breadth from there and a full hand's breadth from the knee. And I would not go any further in than about halfway down. So I'm gonna go this way and halfway down here. So my site would be about here. And then I'm gonna have her lay on her side. For the ventrogluteal injection site, I would place my hands on the greater trochanter and have my thumb facing towards the groin and my pointer finger facing towards the spine. And I would position these hands spread out close together, and I would administer it about right in between here in like the meaty area. And then I would go back to the patient's room and just check on them as indicated to make sure they were not having any adverse reactions, and that concludes my assessment.